VA treats over 6 million veterans yearly. Did you know more than half of VA outpatients are over age 65, or that nearly a third are over 75? I'm Ken Shea, Director of Geriatric Programs at the Veterans Health Administration. As people age, chronic diseases make many of them dependent on someone else just to get through the day, get out of bed, get dressed, or take medications. When these needs are more than family or friends can handle, professional help is needed. Since the 1990s, VA has been moving away from addressing such needs in nursing homes and instead has developed a variety of approaches permitting dependent, aging veterans to choose to remain at home in the community among friends and family. VA's Geriatrics and Extended Care Strategic Plan directed us to adopt new but proven services to expand veterans' choices for care. Our Undersecretary for Health committed VA to provide care that is, above all, patient-centric, configured around the needs of each patient rather than around existing facilities and processes. He has pledged we will deliver care to America's veterans that is accessible, evidence-based, and continuously improving. I'm really excited to share with you, our stakeholders and customers, some examples of VA's non-institutional alternatives to long-term care. A sample from nearly 80 programs introduced since 2009 in sites from Vermont to Virginia, San Francisco to Florida that provide dependent, elderly veterans and those who care for them a range of proven new choices for staying connected with their families, their communities, and with the country they fought to protect.
Okay? In September, my husband became very, very ill. We were spending more and more time in the hospital, in the ER. He dealt with depression sometimes because he would much rather be home.
Program at Home is a research-based home hospital program that is run by physicians and nurses with the goal of either preventing hospitalization or getting patients out of the hospital earlier.
Program at Home started 10 years ago by delivering care through house calls. We're making house calls again and delivering care just like in the hospital, but in the comfort of someone's home.
So I'm going to draw your blood today, and then
we're able to provide EKGs. We have point-of-care lab testing. We can give them IV antibiotics or diuretics, whatever they need. We can make sure that they're taking their medications correctly because there's a lot of changes for medications in the hospital.
Well, as a caregiver, you don't want to give the wrong medication. Just to be able to pick a phone up when you feel like you're in crisis and say, you know, Dr. Costas, this is going on, and then he calls the nurse and explains to the nurse what's going on. You're not left alone.
When we can get patients out to their homes from the hospital in a safe and quality environment with the supports they need, that opens up beds for other patients to come in and utilize.
Morning. Oh, good morning.
The patients recovered just as quickly, just as safely, and the complication rate for things like confusion and falls was lower than if the patient had been in the hospital.
Beautiful.
Patients love it. Families love it. We feel honored to be able to deliver this service to people who've served our country.
With home health, he's home and he's secure, and we have a lifeline.
My mother was feeling overwhelmed and depressed taking care of my father, who has dementia. The Coatesville VA has a program in place to help my parents and other veteran families.
The name of the program is Dementia Competencies at Home, and the mission is to maintain our veterans in their home through dementia care education and support to their caregivers. First, we assess veterans in the Golden Memory Clinic. We examine them for their memory and functional status. We also assess the caregiver's burden. After the initial consultation, I schedule a home visit with the caregiver. One of my greatest concerns is to create a safe environment for our veterans. I go over things like fall prevention, firearms in the home, and wandering caused by dementia. I help caregivers get the tools they need to keep their home safe. We can also keep in touch with caregivers through regularly scheduled video visits. This way, they can have face-to-face time, and we can see if the caregiver seems stressed or run down. There is also a touchscreen device on the video unit with a series of questions that the veteran can reply to on a daily basis. Their answers help us assess their functional status and mood.
The program has been a real benefit to my family. I don't worry as much about my mom and dad. It's been a blessing.
We always tell our veterans and caregivers, we are here to serve you since you served our country.
The first facility that we put him in wasn't able to handle him because he kept walking off and would not stay in the facility. It was very difficult. No. He was becoming unmanageable, and I was just at the end of my rope. I just didn't know what to do. When the PACE program was offered to me, it was like a godsend. It was a burden lifted off my shoulders.
How are you? I'm fine.
The goal of PACE is to provide all-inclusive care for the veterans. Just about any service that they might need is provided here in one location. They have doctors, nurses, occupational therapists, recreation therapists.
We're going to sway from left to right.
Physical therapists.
We're going to do the bicycle, okay?
Pretty much comprehensive care for the patient on a day-to-day basis.
They play music. He likes to play the guitar. They dance. He loves to dance.
What is different about PACE is it flips the traditional acute care model on its head. It enables us to really focus on preventative medicine. It allows us to really take care of the patient wherever they are.
They took care of his personal needs as well as his physical needs. I was able to go to work and know that he was really being taken care of.
We are here to provide the best care possible for veterans, and PACE has become an integral part of that. See the smiles, see the interaction they're having with the staff. It's a great program.
Without the PACE program, I would be totally exhausted all the time and probably in a depressed state. So this has really, really helped me. Like I said, it's just a godsend.
With the aging of the veteran population, there's a growing demand to address multiple medical and mental health problems in a timely way. This model, integrating geriatrics and mental health embedded in primary care, is uniquely suited to better manage older veterans' medical and psychosocial needs.
For example, an elderly veteran presents to primary mental health care because of family concerns of a change in mood or behavior. During the psychiatric interview, the mental health provider determines that a geriatric assessment to screen for dementia or other geriatric syndromes is indicated. A member of the geriatric team is contacted and the veteran is seen, usually the same day, instead of waiting up to 45 days. Standardized screening tools evaluate caregiver stress and cognitive and functional capacity. Social and psychiatric evaluations give us a sense of the health risks, social support, and physical limitations, all within the primary care setting. Typically in primary care, social work services are reactive. This program is much more proactive. We're often able to do an evaluation before a problem begins and monitor the veteran's progress closely over time. That's better for the veteran, the family, and the VA.
Our goal is to identify elder veterans at risk, manage geriatric syndromes, and promote independence. Furthermore, this pilot program functions as a GeriPact, dramatically improving access for our veterans and reducing costs for the VA.
My dad was admitted into the hospital, and after they released him, he was enrolled in the GRACE program.
Go ahead and check your blood pressure now. Is that okay?
Our goal for GRACE is to serve as many veterans and their caregivers as possible, keeping them in their home as healthfully and functionally and safely as we possibly can.
I've been receiving wonderful care. I couldn't get along without the GRACE program. Whatever we need, they get it for us.
What makes GRACE so effective is that the GRACE team, comprised of a nurse practitioner and social worker, act as a liaison with the VA primary care provider, and then we bring the home perspective back to the team of geriatrician, pharmacist, psychologist, social worker, and nurse practitioner.
When they first came out, Erica, the social worker, she was telling us all about the program, and Rebecca, the nurse practitioner, she was here to meet his health needs. He don't have to go out to the hospital. She's here to, check him out.
The VA is moving forward to provide 21st century care that is patient-centered. Being in the home is critical. We're able to assess and evaluate and meet the patient's needs better with this perspective.
We have served over 260 veterans and their caregivers so far in the last 2 years, and we are thrilled with the results we are seeing. We have seen a decrease in their 30-day hospital readmission rate by almost half. In the last year, we have been able to save over 60 hospital admissions for these veterans and saved 400 bed days of care for our VA Medical Center.
Looking really good. Keep up the good work.
Thank you.
All right.
They're caring people, and it really makes me feel good to have them to come into the home and care so much about my dad.
I've lived here almost 20 years, and the Tampa VA team has helped me stay in my home and out of the hospital.
I think that it is very clear that frail elderly veterans are at high risk for rehospitalizations due to medication confusion, home safety issues, and many other factors. The home-based transitional care program significantly reduces readmission rates, especially within 14 days of a hospitalization. Within 4 days of a hospital discharge, a nurse and a therapist will do an in-home evaluation and assessment. The nurse specifically will focus on the hospital discharge plan of care with the patient and his caregiver.
I find that you see the true picture when you go into the home. I do follow-up care for the veteran for up to 28 days after discharge, and one of the most important things that I do is education about their medication management. Often, patients are confused about medication changes, and that can be a serious safety issue.
As a kinesiotherapist, I complete a functional and environmental assessment in the home and order adaptive equipment such as grab bars and wheelchair ramps, anything to prevent falls, which is a common cause of hospital readmissions.
Based on our satisfaction surveys, 95% of the veterans say the home-based transitional care program increased their overall satisfaction with the VA. We are committed to keeping our valued veterans safe and at home.
As you have seen, these pilot programs are enhancing the choices available for veterans by allowing them to stay at home among family and friends. What do you think? You're VA stakeholders, our leaders, our clinicians, and American taxpayers. Each of you is our most important judge as to whether we are delivering accessible, proven services for our aging veterans, the men and women who made sacrifices to serve and protect our nation.